Bismillahirrahmanirrahim. Alhamdulillah. Wassalatu wassalamu ala Rasulillah. Hello, dear friends. It's my pleasure to talk to you today. Because of the coronavirus, we have the quarantine and everybody at home. So, I would like to introduce to you how you can manage dental pain at home whenever you cannot see a dentist. I'm Tahir Al Umari. I'm from Jordan and I'm an assistant professor at Jordan University of Science and Technology. About the type of pain. Dental pain in general can be divided into mild pain, moderate pain, and severe pain. In case of a mild pain, we can go for a Panadol, for example. So we can take 2 tablets every 8 hours, and the maximum would be 6 to 8. It should be enough to control mild to moderate pain. In case we have more severe pain, another option would be the non-steroidal anti-inflammatory, and the most famous one is the ibuprofen. We have a combination, or we have different dosage of ibuprofen. We have the 200, the 400, and the 600. And the best combination in case of moderate to severe pain is a combination of paracetamol and ibuprofen. So you can take 1 tablet of the Panadol, for example, and with the same time you can take another tablet of ibuprofen, and both of them, they should work very fine for 8 hours. Now, if you don't want to use ibuprofen, you can go for other combination like Voltaren, which is well-known and famous as well. We have to tell everybody that if you are taking the non-steroidal anti-inflammatory ibuprofen or Voltaren, you should have a full stomach and should have drink enough water. Now, a study in 2004, they compare the ibuprofen or alone, ibuprofen and Panadol, and a placebo. The three groups were severe, moderate to severe pain, and the ibuprofen decreased the pain to a mild pain, but it continued until 8 hours as a mild pain. The placebo work on the psychological effect, and it decreased the pain initially, then it increases again. However, the combination of ibuprofen and the paracetamol together decrease the pain totally in within 1 hour and continue controlling the pain for 8 hours. So if you have like a severe pain and you have the painkillers at your home, it's better to combine the paracetamol and the ibuprofen together. Now, do you need antibiotic? This is a question that we could answer with no. You don't need antibiotic for pain. Only you need antibiotic if you have a swelling face, an increase in your body temperature, and a sign of generalized infection. In this case, you need an antibiotic. It's not always possible to reach an antibiotic, so probably you can go to the ER in the hospital. They will administrate for you an antibiotic. Remember, my friend, if you are a diabetic patient or if you have any immune issues and the swelling move from one side to another side, this is a life-threatening case, and you have immediately to go to the hospital. Now, regarding of an antibiotic, if we need an antibiotic, which type of antibiotic? In a review in 2017 published in the International Endodontic Journal, they conclude that the best antibiotic we can use is the penicillin in general, amoxicillin, or the augmentin. So you can use any of them if you need an antibiotic. And they also conclude that antibiotic only administered in cases where we have an immunity issue or cases of cardiac prophylaxis, such as previously infected endocarditis or prostatic heart valve. In those cases, we need really to administrate antibiotic. Otherwise, there is no need for antibiotic at all. In case of an allergy to penicillin, you can go for clindamycin, and just remember that clindamycin have a problem. It can cause pseudomembranous colitis. So it's better not to go directly to clindamycin except if you are allergic to penicillin. Now, in case of localized swelling on the inside the oral cavity, you don't need really an antibiotic. Remember that this information is delivered for general people, not for dentists, so they know it. Dentists know in general that they don't need antibiotic for such cases. However, patient, they don't know that. So if you are a patient and you are aware that you have a localized infection in your mouth, you don't need an antibiotic as long as it's not systematically involved. Another study in 2016, and in this study they compare the use of corticosteroids, dexamethasone or prednisolone, for pain control, and they find that in case of severe pain, an injection of the prednisolone could control the pain for a week time. So in case you are like in the ER and you have a dentist to treat you, only you can find a medical staff. He can give you an injection to control the pain beside the painkillers. The local anesthesia, intraoral local anesthesia, could help in some cases, but not in most of the cases. And finally, we could say that the clove oil, it's available and you can find it in all kitchens. The clove oil have a combination or an oil called eugenol, and that oil is sedative and antibacterial at the same time. We use it as dentists in our facilities in general. So in case you cannot reach any place and you don't have a painkiller, this could be a helpful combination. You can just squash it and add it some water, make it the paste, and place it over the tooth until you can reach a medical facility to treat your tooth. I hope that the world could pass this coronavirus pandemic, and we wish all our friends and all over the world best of luck fighting this virus, and stay safe, stay at home, try not to go outside, and hope it will be fine with time. Hope to see you soon, my friends. Thank you very much.